Heavenly Father, please help us to make the right decisions for our Corner County people. Amen. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Well, please. Here.
Thompson.
Here.
Drummond.
Here.
Gothier.
Here.
Brady.
Here. Accept the motion to approve the minutes from June 15th.
So moved.
Support by moved and supported by Carolyn and Bill. Any further discussion? All those in favor? All opposed? Motion carries. First, I would like to make some modifications to the agenda. Number one is I'm going to add Lenny Avery to the top of presentations for some exciting news for Oklahoma County. In the ACCOA, I need to add to new business GIS contract change and reauthorize this to sign. And John can speak to us about that a little bit. And then as requested by the Personnel Committee, sorry, my bad, I'm reading some notes at a time here, to remove the unfinished business Teamsters Equalization Building Department letter of understanding for the to the next meeting for more information required. You're right. Well, let's begin with no other comments or questions. Public comments, 3 minutes. Anybody here with public comments? Oh, sorry, Gary.
Yeah, Gary, Fishing Township. I just wanted to speak on the resolution last week, between all the stuff that was going on. I was a little rushed. I guess my biggest problem with what goes on with the Secretary of State's office is the inaccessibility to it. I mean, the conditions they slap on it are ridiculous. You miss the appointment, it's about not being able to make an appointment again. They don't say what the duration is for. If people don't have email and somebody else makes the appointment for somebody else, they can refuse to see you. It's just gotten totally out of hand. It is not convenient for people to use. If you're on your way doing errands, it's easy to work with. I can give them a check, ask for a tab. I get it immediately. I don't have to pay an extra fee for it. And that's not even one of the options on the list. So I talked to one of the other commissioners that said they were going to rewrite it. So I'm going to hold back any of my further comments. But I thank people that brought it to the table, that voted for it. I appreciate it. And I'm willing to look at that subject again in a couple of weeks.
Thanks, Gary. Anybody else?
Yes. Okay, where do I start here? Okay, so I just wanted to ask everybody, so we can all agree that our elections were stolen, right? Yeah. Yeah, yeah, you think so? So the consensus is about what, 80%? Most of us believe the election was stolen. Okay, so what it comes down to is the election machines and the accreditation. So I hear that, but you probably, I should have gotten you a copy of this. Did you get this one? No. So it's basically a it's a, well, this is how, basically it shows how the HAVA Act was formed in 2002, how the EAC was formed by the HAVA Act, because the HAVA Act's an actual law that was written by Congress, right? So we have to follow the law. But the HAVA Act, they were able to form the EAC. And then under that, they were able to do the Institute of Standards and Technology, and then the Voting System Testing Laboratory. I don't know, did you get this one? I emailed you something. So here we go. So in Michigan, we use Pro V&V, and you can start looking at where the stuff wasn't accredited. You know, where they didn't keep up their certification, where they didn't do their accreditations on time. And at the very end, the EAC didn't even have a quorum. They didn't even have a quorum to put themselves on the board to form the EAC. So, I mean, if you just take the machines all the way out of it, you just take all these investigations, all these lawsuits, all the way out of it, and you just do Occam's razor, you go all the way down to the EAC. And the machines were never certified. So basically, the machines we have in our thing, the machines we have here are not certified. They're not certified, and it can be proven. There was actually a lawsuit filed yesterday in claims court by somebody we know in our group. They filed a lawsuit. It's pretty awesome, and it's pretty straightforward.
At the state level.
Court of claims, probably in there. I'll get you a copy. I'll get you a copy because the one I did here is all highlighted on, and I don't think it'll make a very good copy. But so what it comes down to is, let's go right to it. So the HABA Act enables the EAC to do their stuff, but then they're supposed to have testing laboratories that were never never. Basically, at the end, they didn't have a quorum, and they shouldn't have ever put the guy on the board to go ahead and certify the machines. And the Board of State Canvassers is the one that says, yes, use those machines. So basically, the Board of State Canvassers shouldn't have done what they did. And then, the EAC going back. And then here, right here, and here, in the Michigan compiled law. So this is legislation. Our legislature made this law, so MCL 168.795A describes this. And then this, but I don't know which one I got read first. Let's see, I think it was,
You got
so
about,
this,
you got about 45 seconds.
okay, MCL 168.795A. Prior to purchase and use in Michigan, and vendors seeking approval of an electronic voting system shall do all of the following. Electronic voting system shall not be used in election unless it is approved by the Board of State Canvassers and meeting requirements of section 794, 795. And instructions regarding recount the ballots cast on electronic voting system shall have been issued by the Secretary of State unless section 79C has been complied with and unless it meets one of the following conditions. Is certified by an independent testing authority accredited by the National Association of State Election Directors and by the Board of State Canvassers. This didn't happen. And I can show you guys here. They didn't do the testing. The guy that they hired to do the testing from the laboratory didn't even do what he was supposed to do, and if they fell through on all their stuff, ended up not even having a quorum. So they can't say that we can use the machine. And then here's where it's your job. This is your job. This is the clerk part, and it's the MCL. So again, the law. The law, we have to follow the law. The Secretary of State shall allow a county clerk in consultation with the clerk of each city and township located in that county to determine which electronic voting system will be used in the county as long as the electronic voting system selected meets both of the following criteria. Okay, so it has to be the same type as in a uniform system. So one that all of Michigan decides to use. And then,
We gotta wrap it up.
okay, hold on, one more thing.
Go to the end of the
Okay, will you,
slide.
any 3 minutes, anybody's not speaking? The electronic voting system is approved and certified as provided in section 795A. Okay, so the clerk, it has to be one that's approved and certified based in 795A. And 795A is the law that states, here, this one. You can just write that down, 168.795A. Oh, you got it. You're awesome. Okay, so what this boils down to, and this is where the important part comes in. We can't have elections on these machines. We can't have elections, so we have to form a committee of people that want to look out to see what paper ballots we're going to use. Because as of right now, everybody that's running for office, it's like a facade. It's a facade until we fix 2020, until we fix the election. But if we do it the right way, and we say, shh, can the machine, and we get paper ballots, then we'll do it the right way. But I think we can all agree together. There's no reason we can't all agree together that there's, basically, this is Occam's razor. This is the way you say, we don't go to all these people. Alex Halderman, Michigan State University. You know, J. Alex Halderman. He did the whole report.
All right, you got 6 minutes. That's all I can do, I'm sorry. But you
So-
want to wait around, but it's 5 minutes at the end, you can do, you can. talk
Well,
at
what
the end.
the main thing too is I want everybody to remember that we took an oath. I took an oath to defend and protect the Constitution. You guys took an oath when you signed up for office. So if there's a law and it's illegal, basically what we're doing, then we should abide by the law and the Constitution. And serve our people and find a way to do it all together. I'll help. I think we'll all help. Thank you.
Thank you.
Thanks.
Anybody else, public comment? Yes,
As far as taking off the letters of understanding from Teamsters, 3 weeks ago, it was requested that the personnel committee meet with Gary and I. We got 0 response. And I'm really hoping that this is the last delay before we get an answer. I don't know what else to do.
anyone else, for public comment? Nobody in house, nobody online? Then, oh, I'm sorry, go ahead.
Clarification, I have additional information about the committee voting machine.
Sure.
You know, there was some things that were found in a Colorado in 2 elections, November 2020, but also April 21. Independent cyber experts determined that the software and the machines were performed in secret operations that manipulated the ballot data. So, and we also saw that in Antrim County. So I do have a list of the things that they found, and you guys would like to look that over, but I appreciate it. I really don't think we should be using these machines. I went to the election training, and pretty much the training was about operating the machine. I really think our county is not that big, and that we could save a lot of money by not renting these machines and also having an election source as to run our elections. So.
Plus, they're saying at election source training that we're supposed to be using Sharpies. That's the training, and in Michigan law 168 point, I got it.
I'm being very patient.
It says black or blue ink only.
Okay, thank you.
So I have copies.
Leave it with the clerk, if you would.
Oh.
Thanks very much.
I don't catch your name. Oh, Barb Case.
Any more public comment? Okay, then let's have Lenny come up. He's got some fantastic news about Algonah County.
Okay. So, let's try this again. There we go. Thank you, Board of Commissioners, people in attendance here. Can I use this if you don't mind? Okay, I apologize. I don't have a clicker, so I'm going to be going back and forth. My name is Lenny Avery. I'm the Executive Director of the Algonah County Commission on Aging. And about 2 years ago, I came to this board and this body with a crazy vision that I believe, I'm a man of faith, so I'm not going to be afraid to show it, that God dropped in my heart. With that, I want to kind of remind you of what the vision was. So what we looked at doing, it was to create a multi-family housing project that would incorporate 44 units. We use mixed use for senior living and multifamily. We wanted to also create a 50 to 80,000 square foot community center with amenities. And we targeted that to found in Lincoln, Michigan. So this is kind of like the site layout. I'll kind of touch the screen so people can see. This is the Dollar General, and we acquired 14 acres of land right behind Dollar General. Okay, so what the site layout is, this was going to be our community center. Right here is going to be housing building 1, housing building 2, with green zones in the middle, as well as amenities like a splash pad that would turn into an ice rink, tennis courts, sand volleyball, indoor racquetball, whole bunch of cool stuff that we wanted to do for Lincoln, Michigan. So don't worry, I'm getting to the good stuff. You just gotta draw it out like everybody else does. Okay, so we wanted this generation. We just didn't want to have a senior center because it's not just seniors, it's everyone in our community that's going to benefit from this by having a multi-generational approach. So having occupational therapy, having a county senior center, indoor walking track, 4,000 square feet of exercise space. My gym is the only exercise facility that we have in Alcona County right now that's open. Dance studios, fitness, adult day center, congregate dining, business incubator, and the list goes on of all the stuff that we wanted to get in there. Also with everything for our multifamily housing, looking at having green development, workforce housing, and new construction. Construction that was built back in the Reagan administration. So we did a research study. We did a feasibility study that targeted over 1,000 Alcona residents. So when we got some quotes, unfortunately you can't see it because they're over here, but it said the Center for Extracurricular Activities, that would be inclusive for there you go. Activities that would be inclusive for different types of activities. You know, so we had over, like I said, 1,000 participants. And most of the participants, as you see, over 80% scored it as a highest value of all those participants. So we took all of this aggregate data and we put it into our computer and we set that numbers out to the state for this feasibility study. And we said, hey, this is what we need in our community. You know, we said that the highest group of need in our community are from our children and seniors, you know, also adults and veterans. Then we had some people that was also talking about farmers and agriculture. And if I can increase this group and help those people understand, then entrepreneurship is also just as important as some of these other groups. So we did all of that, did all this work over the last 2 years. Yes, people asked for a poll and I said, absolutely not. So all of this information, you know, we talked about farmers markets, computer and technology centers, workforce startups, business incubators, all of these different programs, everyone had their voice into these surveys. And we have all of this aggregate data that we still have. And we put that into a package. So we designed a proposed site that would look like the housing that we wanted to do. And it's very important that we said we didn't want people to look like they lived in low income or didn't want this not to look and feel like Alcona. We didn't want big city look. We wanted, you know, nice and cozy. Some of the layouts of the plans that we looked at are, you know, first, second, and third floor. This will be amended, but some of the units are going to be 3-bedroom, 2 bedrooms, and 1-bedroom units. Okay, so this is kind of the layout. A 3-bedroom layout is about 1,400 square feet, 2 bedrooms, 1,000, 1 bedroom, 683 units in the layout. So why are we doing this? Well, I believe in Alcona County. I believe in our people. We're salt of the earth people. I'm a transplant here, but I live here. I pay taxes here. And I also keep my ear to the ground. And I know that things are happening right down the road from us, 19.9 miles away. And I do remember, because I can tell you, I have people that eat at my table who tell me what that air base meant to our community when it was fully operational and when it was open, how it brought jobs, how it brought opportunities. And we believe that this is going to happen, that this is going to reopen. So we're at the center of this. Like I said, we're 19.9 miles away. You go up the back road, 41 right here. That takes us right there. So we are in the crossroads between opportunity and growth. So I talked to our elected officials, Senator Jim Thomas and Representative Sue Allor. And I got in front of them for the last couple of years and we talked some more. I went down this past 3 weeks ago without an appointment and I met with 26 different legislators to bring our community to their attention. So I am going to attempt to read an official press release that is from us. I'll give you each a copy. So, for the press release for the Alcona County Commission on Aging with regards to its Lincoln Community Hub project, the Alcona County Commission on Aging recently received a state allocation grant of $12.5 million to the Economic Development and Workforce Grant. Section 1094 for the fiscal year 2022 and 2023 General Omnibus Appropriation Bill. Thanks to this grant, the Oconee County Commission on Aging is able to provide much needed housing to the residents of Oconee County, especially those living in the Lincoln area. There's a quote that I always like to use. It says, if your dreams don't scare you, you're not dreaming big enough. This housing project is part of a larger program initiative. The ACCOA CARES, CARE stands for Connection, Advocacy, Recreation, Education, and Service. This initiative is a project designed to target multiple areas of needs within our community and surrounding areas with a multifaceted, programmatic, person-centered objective under one roof. These programs will create opportunities for health and wellness for our residents, promote caregiver wellness and empowerment by providing education to enhance the caregiver experience, provide access to state and local services, create a senior adult daycare service, create a non-emergency medical transportation program. Poor services delivered within local bodies is becoming a barrier to communities that they're served. Oconee County is no different. Rural communities face just as many problems as their urban counterparts. Income levels, educational attainment, race and ethnicity, and health literacy all impact the ability of people to access health services and to meet their basic needs, such as clean water and safe housing, which are essential for staying healthy. Rural residents are more likely to experience some of these contributing social factors that impact health, such as poverty. The impact of these challenges can be compounded by the barriers already present in rural areas, such as limited public transportation options, fewer choices to adequate healthy food, and the lack of access to the state and governmental services. Although urban areas seem to tip the balance between population and need, rural America experiences health disparities at the same rate. Increased mortality rates, lower life expectancies, and higher instances of chronic diseases and disabilities are compounded when coupled with limited access to healthcare, geographic isolation, lower social and economic status, and inequality in healthcare coverage. ACCOA seeks to serve as a centralized hub for all the programs mentioned above and other specific applications to target issues facing Oconee County residents. Having residents' health and coordination of care is vital to the health of Oconee County residents, as well as having access to affordable housing, social services, and recreational activities and exercise. So, summarize all of that is that this crazy guy had a dream and the state said, we like it. And that we've spent all this money in urban areas. Now they realize that rural people count too. And they gave you and this community $12.5 million. And it's just a sum. Thank you.
Thank you.
Okay, next up, presentation, Nina Sword, executive. No.
Congratulations.
Thank you.
Great. No, my history says that these out because I need copies or you have them. Okay, we'll put some out here for full report for people. All right. Well, my name is Nina Sork. It's good to be here again. This is by the mental health bill, annual report to the county commissioners that we serve. So the first good news is Northeast Michigan Community Mental Health and our prepaid inpatient hospitalization. The Northern Michigan Regional Entity, NMRE, who's we're part of that, remain fiscally sound. So for the past several years, we've been able to report to our board and our community members that NEMCMH is fiscally sound. Additionally, our regional prepaid inpatient health plan at the NMRE is also viable, and we're fully funded in our internal savings plan. So we've maxed out what we can put away in our savings. And for the 21 counties in northern lower peninsula. Now our annual report for Northeast here for 2021. As you can see on page 5, we served 2,073 individuals last fiscal year. These numbers, I want to point out, are consistent with fiscal year 18-19, where there was no pandemic, and the year prior to the beginning of the pandemic, and also the year during the pandemic, 19 and 20. So our numbers and our services and who we were able to reach out to remain very consistent throughout the shutdown of the state and people being unable to get out and to go to work and shop and do those things. Our staff still went out in the community and served people. So we kept our doors open and full access to our services despite health restrictions, workforce shortages, recruitment challenges, and staff being quarantined. I'm also pleased to announce that on August 1st, just less than 30 days, we'll have a new psychiatrist coming to our region. Her name's Dr. Alicia Thibault-Ladke, and she graduated in June, and she's beginning her career with us. She's originally from Alpena, graduated from Alpena High School, went off to college and medical school, and is now coming back to serve our area. So we have 3 full-time psychiatrists, one that lives in Alcona County, one that lives up in Prescott County, and Dr. Thibault is from Mount Morency County, and she's looking to find a place either in Mount Morency or Prescott. I'm not sure if they made their decision yet, but we're really fortunate. And one of those 3 psychiatrists is a child psychiatrist. If anybody knows anything, there's only about 3,500 of those in the whole country, and we've got one of them in our catchment area. So that's really good news for us. In 2021, in October, we began our fiscal year, and this is really exciting for us. We became a pilot site for the state of Michigan and DHHS to implement behavioral health homes. It's a model of care. It's not a physical place. So behavioral health home provides enhanced benefits for community mental health clients to also receive physical health care management. So we're doing integrated care of mental health as well as physical health with people in the BHH. So the behavioral health home has a nurse care manager that assists clients experience a mental health issue and a chronic health condition. The nurse care manager will link and coordinate services, assisting clients to be successful in managing their healthcare problems. In the BHH program, the nurse provides contact and support in the community as needed. And a second team member, a community health peer support person, meet the clients in the community and assist them in developing healthy lifestyles, assisting with appointments, providing education and support to address their health issues. Some of the things we've done, we've put in a workout room in our building so they can come in and work out with staff. I purchased bicycles, and they can check out a bicycle like a library card, and they can take people out for bicycle rides along the bike path. We're putting that up in Rogers City as well. So both programs offer clients health assessments, individualized health treatment plan and goals, and monitor their conditions. So what is a health home? It's a model of care. It improves outcomes and long-term recovery, coordinates and provides healthcare needs, increases hospital and post-discharge follow-up for people, reduces unnecessary hospital visits and unnecessary ER visits. Let me give you a little example. We had someone that was constantly going in the ER because of their asthma last year, and they couldn't breathe and they'd get in trouble. So because of the behavioral health fund, I have some funds that I can do discretionary. We put an air conditioner in their apartment, they stopped the ER visit. So $200 and something air conditioner, saved thousands and thousands in ER visits. So Northeast has been actively focusing on becoming more involved and more visible in our communities and promoting our crisis services also. For all the people in Alcona County, we've been doing more interviews, enhanced use of social media, partnering with other nonprofits, targeting the schools and families and school-age children. We gave every student in the Alcona County earbuds and thumb drives because they were all given Chromebooks. But one of the staff said they don't have thumb drives or earbuds to use, and it has our webpage address and our crisis number. So families now of every child knows how to reach us and what kind of services that we've sent home with them also in Friday folders and things. The other thing is that we're very concerned about the high rate of suicide. So we're targeting a lot of suicide prevention. One of the things that we've targeted for Alcona County is in August, our staff is training every school employee in junior high and high school in suicide prevention program. It's called Safe Talk. So everyone that works at the school, you don't have to be a teacher, you can be the custodian, you can be the lunch person. You're there, we're doing a training those that week of their education before students come back. And it's a 4-hour training in self-talk, and also we've contracted with Partners for Prevention, and they're coming in doing mental health first aid and youth mental health first aid. So we've also participated in take back events, blood drives that support the whole 4 counties. We're also focusing on becoming good community partners, and we're working on providing community education to reduce stigma, reduce the number of suicides, provide support for mental health crises, and try to connect individuals with available resources. We've done youth mental health first aid, regular mental health first aid, suicide prevention work, assist training, safe talk, and training on ACEs, which is a test that we give students to register their trauma histories. We've partnered with ACC and trainings at Granholm Theater for all people in our 4 counties. And we're now we've become certified with ACE, that we can offer like social workers credited, so that social workers every 3 years have to get 4 hours of training. Usually you have to go downstate, pay travel, pay, hotel, conference. We're bringing speakers up from downstate, providing it here. So whether you work for hospice or aging community or the hospital or our health department, you can come and we're working on nurses credits too next. So right now we've got for social workers. So that's something we're trying to do for the communities we serve. The other thing, I don't know if you're aware, but Alcona County has one of the highest rates of suicide in the entire state. It's the state average is 13 point something suicides per 100,000. Alcona County is 28.6. The only county that's higher is Oscoda, the one right next to you, and that's 30 suicides per 100,000. So when that article came out, I read those numbers, I was flabbergasted, because at community mental health, we certainly haven't seen those rates of suicide within the people we serve. So the report went from 2005 to 2020. So we went back, and very, very few of those suicides have been with the people that we serve. So we know we've got to do a better job of reducing stigma, getting our crisis number out there so people know where to go when they're having those thoughts. There's a higher concentration of veterans that move to our lower counties here, lower peninsula. So they have high rates of suicide, so they believe that's what makes it up. There's no access to medical care. There's no access to psychiatry. Back in 2005, we had telehealth for psychiatrists because we couldn't recruit hardly any. Now we've done a much better job of recruiting. We've got 3 full-time psychiatrists starting August 1st. So we're working at trying to reduce that. We're targeting the children in schools, and then we're working out from there for families. What we found a little bit in our data, even though we didn't have very many, most of those, I wish Lance here because I'd love to partner with them soon, is age 40 and up is where the majority of suicides in Alcona County seen. And it was people in the private sector, people with private insurance that can't get in to see a therapist, can't get in to see a psychiatrist, have to drive for miles for those appointments. So that brings me into last year, you guys, thank you very much, passed a resolution on the Senate bills 597 and 598, trying to privatize the public mental health system. So let me just finish up here a little bit about that. Thank you very much for your support. Michigan Association of Probate Judges, Sheriffs, and County Commissioners have all said it shouldn't be privatized. But let me tell you a little bit about what's still happening. It's still there and it's still moving through, but not with a lot of support, so we don't know. But there's definitely a mental health crisis in the state of Michigan. I also do a private practice, so I've done that for years. So I see people who have private insurance on the weekends, okay? However, the greatest failure for mental health is in the mild to moderate populations, especially for people with private insurance like you and I, or my family or friends. We must wait weeks, if not months, to see a psychiatrist or a therapist. If you live in a rural setting, then you must also drive hours to see a
Put on a Word document.
health professionals that are available, trying to refer to, aren't taking new clients, or it's a long waiting list to get your first appointment. So now this bill wants to put the most vulnerable people in our communities, the seriously persistently mentally ill, and also the people with intellectual developmental disabilities, and into a private system that already isn't able to serve the needs. And it's the same private nonprofit, or the same private for-profit service that's already failing individuals in the private sector. For the past 50 years, the mental health system in Michigan has been run and operated county-based governments, entities to serve Michiganders with their complex mental health, emotional disturbances, intellectual and developmental disabilities, and substance use disorders. The study by the Center for Healthcare Innovation and Integration found that Michigan, of all the states, public mental health system has a long tradition of high performance. Each year, more than 325,000 residents of Michigan receive their services and care from a Michigan public mental health care system. This legislation that's under consideration in the state Senate would eliminate the existing $3.5 billion. Okay, that go to treating and taking care of the most vulnerable in our communities. Of these state and federal dollars annually to the private for-profit insurance companies based in Missouri, California, Minnesota, Arizona, and Indiana. That's who would be managing that $3.5 billion for us. My fear and the fear of other public mental health administrators is that if these bills pass, then the money will be centralized in an urban area, and that our most vulnerable people up here in the rural communities will be in competition for the needs of the urban area, and we will have difficulty getting the financial support to provide care for the people that we provide services to. It's our role in the community to be the safety net and take that role very seriously. It's my role as Northeast to assume risk and to provide services to those high-risk populations. I'm never allowed to say, no, we will not serve you. I can assist anyone in a mental health crisis, and we do. Doesn't matter if you have insurance or not. I can assist you in a crisis and get you stabilized. I can't continue and bring you into services if you have private insurance, but we can certainly try to help to get you to the right door or get you to know where we can get you services. I have eligibility requirements set up by the Mental Health Code and Medicare and Medicaid. So I can do anything though on a crisis basis, and that's what I think we have to get the word out. Call community mental health. We can serve you, especially if there's a priority need for a crisis service at any time. We in the public mental health system also struggle with problems in the mental health system that we cannot change. The area that I'm most frustrated with, and my staff is, we frequently experience roadblocks to treatment, is the area of trying to get someone accepted into an inpatient psychiatric hospital, also a privatized system. It's hard at times to get an adult into a hospital, and it's 10 times harder to get a child into an inpatient unit, a child or an adolescent. You hear these horror stories of the mental health system collapse. That's part of it. A lot of it's private insurance, but even on my public mental health system, I have no control over the private hospitals and who they agree to admit and who they don't. I'm hopeful that these conversations about mental health system will lead to improvements and solutions and advocacy to not dismantle the public system with local and to remain local control. Thanks for your time and your support. I got also a little bit of good news for you. I can't bring you 12.5 million, but for the next 5 years, you're not going to get any increase in your county allocation. So we do that every 10 years based on the census, every 5 years based on the utilization of Alcona residents in our state hospital facility. We have done a very good job of managing people, so you have no increase in your allocation. So you're right there even. Okay, thank you.
All right, thank you very much. Next up, presentations is Harry Harvey.
I guess I misunderstood. I thought he had requested to be here, but
Oh, sure.
can you, Dan?
Yeah, just as the liaison to the building department, everybody's got some paperwork that Harry has presented. And basically, this is coming right out of the state code book. And it's really just describes and depicts what's necessary for small structures. There's been some issues throughout the county on these small buildings getting put up, whether you have to have a building permit, et cetera, et cetera. Harry put this together, Tom Weichel reviewed it. Everything looks in order, and Harry's just asking for permission as our building inspector to send this out to all the township supervisors and zoning administrators, so they understand what happens with small structures.
Yeah, I don't think we need a motion.
I don't think we need a motion. Basically, he just wants to know from us that, yeah.
Sure, then he can host a meeting here if you want.
Okay.
And have all the planning commissions come in,
I'll let them know.
or if you have a zoning also commission and a planning commission.
Eric just wants to, get it out to him, but yeah, if you want
Yeah.
to send a meeting up.
If you,
Okay.
okay, now, David Hanson.
How are we doing today? Dave from Building and Grounds. Just giving you a couple of updates as usual, Well, a big project that we got done is the roofing project is all completed up on the roof. We had a couple little issues come out of the project that we weren't expecting. One of the main issues that we came up with is when they re-sloped the whole roof. Now everything from north in the building goes into one main drain over here. What we discovered is that the main drain coming off this end of the building is not working properly. We had some contractors come in, we cut the main drain line, and we did find out that there was a blockage in the pipe. Part of it was from the current contractors who dropped some styrofoam down in there, but then there was some more blockage down underneath of that they're thinking came from the previous remodel of the roof. Because they're like concrete blocks that were used when they had the old gravel roof on here, and when they were shoveling out the roof, that stuff got down into the pipe. We tried putting a new clean out on there and cleaning the pipe. It's right on the other side of the wall where that cardboard is up on the wall. I had Hal Serval come down, look at it with the camera system, and unfortunately there was more blockage in the pipe. We got a lot of the dirt out, but there's like another hunk of something solid, like a big hunk of that block, right underneath that 16-inch foundation. And there's no way to get to it because from where it's on there, it would be 10 foot underground to dig down. It's 3.5 feet down underneath this concrete slab, right underneath that wall. We have good news is that there is another drain line that comes off of the other end of the building at the far corner that we're going to try and tap into. It runs across the surface of the crawl space before it dives underground, literally just past there where it ties into the main Y underneath the ground there. So we're going to take the existing pipe that comes off, reroute it to the existing pipe, and then we're just going to cap off this one and leave a clean out on there in case we ever have to clean it out going forward, because there is other drains in front of there that are tied into it. What I'd like to do is we're going to replace the entire pipe from over here through with PVC all the way to the end. I don't want to tap into the old cast because that's where we're already struggling with. I've got the contractor scheduled to come in next Tuesday to save a little time and money. I told him that I would dig up the existing pipe. It's exposed at that end. It's exposed at this end. The middle section is only underneath about 2.5 feet of dirt, which I would have to dig out and expose for them so they can get the proper grade on the pipe. They figure the last time we had to fix the drain this spring on the other one that collapsed south of here where the tile was at was $800 to fix that section of pipe. This one's going to be a replacement of 2 lengths of pipe. And our biggest issue with this is it takes 2 guys to do all the work because the only access to this crawl space is down in the boiler room through a 2 foot by 3 foot hole. And everything has to be carried to 80 feet of the length of the building to be worked on down here. And so with their 2 guys and I working on it, we're able to get it done fairly reasonably if I do all the heavy lifting ahead of time. So that's one of the projects that you'll see on the list there. The next project that we came up with is we had the state boiler inspector come in the spring to inspect our boilers. The first thing she noticed is that when she looked down through the glass tubes on our fire tube boilers, that there's all loaded with soot inside of them, which shouldn't be in there. So I had Weinkauf contractors come down. And apparently, our guess is that it's not piped correctly going up through the chimney up to the roof. The exhaust gases are not getting completely out of the chimney, and it's reburning the old exhaust fumes inside of there. Those boilers that were down there were installed in 2011 originally. When we had to replace them, when I started here in 2016 and 2018, we just tied into the existing PVC because it was already there for high efficiency boilers. We should have just, like everything else, should have stripped it down and started over again. To save money, we didn't do that. We just tied into the old pipes. Apparently, the old pipes are not done correctly. Along with that, we talked about it when we were doing the roof. The entire upper half of the chimney is collapsing from using all the years of the incinerator on there. It has cooked all of the mortar joints, and big chunks of the roof keep falling off every time we have a storm. So the original plan was at some point this summer, we were gonna rent some scaffolding, we're gonna take down the top part of the chimney where it's bad and recap it and put a chimney cap on the top of it there. So we're gonna try and combine the two projects together. I'm not sure exactly where that's gonna lead us in cost. They said anywhere from $800 to $1,000 to just clean the boilers. Because they have to literally completely strip them down to their minimal frame to get into clean them, because this normally is not an issue with these boilers. But because we have it, we have to deal with it. So we're gonna try and do the chimney project on top of that. What was the one I put underneath of that one? The next one down the line? No, the fire alarm and security system. So we were working with the security committee about adding more panic buttons, trying to get our alarm system straightened out. Had a walkthrough with Summit Fire Protection. Basically, everything in our building is out of date. And to bring it up to code, we have to replace every single thing in this building. Every smoke detector, every heat detector, every sensor in the building is out of date. We also have to add lights, strobes, and chimes into all the bathrooms, which is 6 public restrooms. I did go to the ARPA Finance Committee. That's one of the things we talked about there, about getting maybe possibly funded through there. The project's gonna be about $27,800. The only thing left is gonna be the red panel downstairs. We can reuse the brain that's downstairs, and we can reuse most of the wires running through the building, but every single connection point needs to be replaced or updated. So that came out of another, just moving on forward through there. When we closed on the jail next door, that's the next one on the list there. Once the jail was closed down, they were complaining about a gas smell in the kitchen all the time in the mornings, and we went over there and found out what it was. It's an old style commercial stove with 4 to 5 pilot lights on it between the burners, the stove, and the cooktop, and it was constantly burning. And without using the exhaust fans in the kitchens and all the windows being closed, it was trapping the gas in there. So we went downstairs to, of course, shut the gas off to the stove, which sounds like a simple process. They didn't install it. At some point in time, when they remodeled or did something, it comes right off the stove down to the main gas line and ties right into the T. Now, the only thing that was added in between the 2 points was the fire suppression system. So if you ever hit the halon system over the stove, it has a gauntlet that comes down and instantly cuts the gas line and shuts that off. So we worked with Summit Fire Protection, and we still have the fire system all activated above the stove, but we went down in the basement and we used our guillotine valve to shut the gas valve off to the stove to eliminate that smell. But however, we now have to have the contractors come in and install a gas valve so that we can get the system all completely hooked up again. It's just another problem after another problem. So I'm currently getting prices on that. I don't have any cost of that right now. And then the final one on there is the MSU building, soil conservation on the street. We're starting to get into some major structural building issues down there. And I'm trying to figure out which route to go on, because it always comes back to that we're leasing the building, not owning the building, but we're still responsible for the maintenance. Some of the things that have gone bad is all the plumbing in the ladies' bathroom, sink wasn't working, toilet wasn't working, had to redo all that. Next, I've got to do all the plumbing in the men's bathroom because everything's going bad in there. Hot water tank isn't working, and when it does work, it's not working very well. So there's a roof leak on the back garage. We know that it all needs shingles on there. I forwarded Bill some of the information back in 2014. I didn't start until the end of 2015. They had got prices to redo the roof. Back then, it was $10,000 just to do that one building back there. I got through the roof goop and tar, and I've sealed up most of the leaks for now, but it looks like the other one's leaking somewhere else. Because in the heated storage area, part of the ceiling has collapsed in the one spot, and I think it's coming down to the one chimney that's up in there. So I'm gonna have to deal with that. They're dealing with the mouse and carpenter ant issue in the building right now. So I went down last week and I weed whacked and killed all the flowers and vegetation around the 3 sides of the building on the back side, so I could get down to the foundation so I could spray it. A lot of the carpenter ants are coming from the door frames because they're all rotted out from where they're sitting in there. The mouse problem is on the west side of the building. The steel door that's there has a rotted out spot in the bottom right corner, and we think the mice are coming in there. The other spot that I did find mice when I was down there last week mowing is on the north side of the building. There's an old chimney there. Now, the high efficiency furnaces that are now are on the other side of the building. There's 2 of them there. The old chimney, the mice have got behind the chimney in the wall, which has a space about this big. There's now a hole probably 3 inches around between the siding and the chimney. So now I have to either tear down the entire chimney to access that hole where they've gotten into the building, or I'm gonna have to cut a hole in the side of the building to access that point. We put a lot of traps on there and we're doing some other things right now. One of my biggest fears is trapping something in that building and having it dying in there and leaving a mess in there. The other issue we're having is at the south end of the building, there's 2 furnaces in the building. The furnace at the south end, the AC unit quit like in 2017. So we've just been using the furnace at the other end to cool the building. Now that one's developing issues from the furnace running so much and trying to use the fans to cool the entire building versus having 2 furnaces to level up the cooling. So I always come in here with bad news. It feels like we make a little progress, 1 step forward, 2 steps back. A lot of the stuff, like I said, I can absorb into my budget a little bit. We budget a little money into the contingency fund, but some of these other projects are going to put me over again. So I'm just trying to give you guys a heads up where I'm going, not including the day-to-day operations, building walls, redoing probate office and other things. So any questions on my list that I've given you? The big one is the soil conservation building. We, building and grounds has talked about it a lot over the last few years, the committee. We're just trying to figure out what direction to go. I've hit that turning point where patching it isn't gonna get me there anymore. We're gonna have to, we only budget a couple $100 a year to do repairs. I'm gonna be out of that by the end of the month, so which means I have to be juggling money around for some of these other repairs.
Paint's not gonna fix that.
Paint's not gonna fix it. Cosmetic issues, yes. Yes,
On the fire security fire alarm, there was a panel that needed to be separated. Is that something?
that's part of the project. That is the main issue they had, is the fact that currently, now with the current panel, the security system for a panic alarms, burglar alarm system are all on one panel. According to new codes, you can't do that anymore. The fire panel is under its own URL listings, needs to be all separate, and then they're gonna install a separate panel, which all of our burglar alarm stuff will go into. We can add and do whatever we want to it, but the fire alarm then will be a standalone system. And that was what I discussed with the ARPA funding committee about doing that.
That's included in the 27.
Yep, that was the total purchase for everything.
Okay,
All right,
thank you.
yep,
You have good work.
thanks.
Okay, on to unfinished business, the patrol car. maintenance.
I'll give it just 2 for you. Much fun. Yeah, so now I checked out the Amberson car. It's the 2015 Impala. But that's not what the bid is for. The 2015 is marked out. And the bids on the 2017 Explorer. Minimum bid $2,500, received from Eric Gill. This one's also on the 2017 Ford Explorer. Okay, so the bids for the Ford Explorer, the minimum bid is 2,500. This bid is for 3,500. And this first one is incorrect. It is for the Impala from Eric Gill in the amount of 700. This was on the old form before he created a new one. Here's the person for the 35. For the Explorer, that is Paul Newman. Vehicle number 1 also, which is the Impala. And this is from James Chase. minimum bid is $625. This is also on the Ford Explorer. The bid amount is $35.15. Is that Lanny Sutherland? Lannis. This one is the 2015 Impala. Bid is an amount of $502 from Lauren DeSonia. And the last one is also on the Explorer in the amount of $28.52, also submitted from Lauren DeSonia. So for the 2017, you also have Lannis Sutherland for $35.15. Is that who you have? Okay. And then for the Impala, 502, 625, and 700 for Eric Gill. Okay.
I'll make a motion that we accept the bid for 3515 for the
No. Oh, yeah.
3515 for the
Yep.
2017 Explorer and the bid of 700 for the 2016 Impala.
If we're doing it, can we bid for all of them, or it's a motion to receive
Oh,
all the bids, and then receive the bids, and then, yeah, write that down still, but.
I'll make a motion to receive the bids, so it's quarter second.
Moving seconded, any further comments? All those in favor? All those opposed, motion carries.
And I'll make a motion to accept the bid of 3515 for the 2017 Explorer and the bid of 700 for the 2016 Impala.
Moving seconded. And Terry. Any further discussion? All those in favor? Aye. All those opposed, motion carries. Second, chance to catch up here. Yeah, second.
Okay.
All right, there you go. Next up, ARPA fund reporting. Dan's got some information for us.
Yeah, on June 21st, we had a ARPA meeting and we have several proposals that were discussed. Our first discussion concerned the Brano Enterprises proposal that we received a couple months ago. We had a lot of discussion on that. The motion was made not to approve this proposal. It was voted on 3-1 in favor to not approve this proposal. So the ARPA committee would recommend to the board of directors to not accept or proceed with the proposal that we received from Brano Enterprises.
Got the motion. Oh, all right, I'll second. Discussion. Hearing none, what's the roll call this one?
We're on this one.
Yeah, spending money.
But the proposal was presented to the board and you have to make a choice whether you're going to accept it with the funding or not accept it. So I don't know how that works, how you've done it in the past.
I also thought that way it's covered. I don't want to get in trouble.
Brumman. Brady,
Yes.
Small,
Yes.
Gothier.
Yes.
Thompson.
Yes. Motion carries.
Okay, so on our next proposal was a summit protection, summit fire protection proposal. Dave Hansen presented the proposal to the committee. The fact that the existing building does not meet code, this is a much needed project. There was a motion made to approve the amount of $27,808 from our upper funding to pay for this project. The vote was unanimous and the ARPA committee, I'll make a motion, the ARPA committee will recommend to the board of directors to accept this proposal in the amount of 27,808.
You're making a motion for the board to,
Yeah, make a asking, the ARPA committee is asking the board. Yeah,
okay. Motion and seconded by Dan and Terry, in discussion. Hearing none, roll call,
Brady,
yes.
Thompson,
Yes.
Small,
Yes.
Gothier,
Yes.
Brumman,
Yes.
Okay, the next we had discussion with our EMS director Scott Rice on the purchase of AED devices for different buildings throughout the county. We had discussion on this and the the ARPA committee asked that this would be sent back to our EMS committee, which is Adam and myself to review this with Scott, our EMS director. Adam and I have met with Scott. Adam and I have reviewed this. We would now try to get our committee meeting back together next week to bring back our discussion and what we perceive to the ARPA committee so they can review what we come up with. So hopefully they can bring that back at our next meeting with a recommendation to the board. So there's no action on that right now.
I am not familiar with all of the springs attached to the Herson grant money. Could that be made available prior to the?
He's got all that in detail.
Okay. Not that I know all the ARPA ones, but.
Our next proposal was from Scott Stevenson, our sheriff. And regarding the purchase of dash cams for the officers, the cost was $27,461 for the cameras. Actually, the $47,461. Scott's already received a $20,000 grant for help for this. So we have a cost of $27,461. And then also there was estimated cost of $15,000 for the servers that would be dedicated to the cameras only. I talked to John, our IT guy. He got official quotes on the servers and they come back at 10,000. Find it. They come back at 10,830.47, and then John said you gotta figure about another approximately 1,000 for miscellaneous materials needed for the servers. So this proposal would be 27,461 plus an additional 11,900 for the service to make this project complete. There was a motion and seconded, and we voted on it. It was a unanimous vote to approve this project to our upper funding. So I'd like to make a motion or request that the board approve this recommendation for these dash cameras and servers and equipment for this needed by the sheriff's department.
Motion by Dan, second by Terry for the dash camera for the police department, sheriff department. Any discussion?
Which, of a question on adding up the different projects, is that falling underneath the total amount? Meaning, like, are we still dealing with I want to call it justified, it's the two different types
Yes.
of funds?
We're not dealing with the revenue loss at this point.
This
This
is
is just
going
project funding that we have budgeted for. Keeping, there was a certain amount that we have budgeted for revenue loss and for projects each year. This is within those projects. And I will have I was asked to have that in accounting and it just didn't happen this past holiday again.
Right. Okay. Thank you.
So I will have that for the next ARC meeting. And then if you can present it to the board.
And the only other request we had received, the board had received a request from Jennifer on trial court regarding the purchase of new recording equipment, et cetera, for our secondary courtroom downstairs. That was kind of table sent back to Jennifer for more research on where we get monies for, and I know everybody's kind of working on that right now, trying to find monies for this project. It's just under $4,000, but right now that's kind of just sitting there, not being funded yet.
Any other discussion for the,
Did you vote on the?
No.
Yeah, you, oh, you didn't vote on the, sure, okay.
I know.
Oh,
Oh, just going back to that.
Oh, I'm sorry.
You jumped ahead, that's fine. I said, any further discussion on the, dash cam project? All right, hearing none, we'll do roll call.
Thompson.
Yes.
Gothier.
Yes.
Small.
Yes.
Brumman.
Yes.
Brady.
And we all heard the update for the last item, so sorry about that. No, no, no. Okay.
I did just, if I could real quick, the reason I keep putting that under unfinished business is actually because back when these were all received, it was that novel was in regard to how the reporting was gonna be handled, and that was never discussed again.
Oh, okay.
Oh,
Yeah, that's why I keep putting it back on there.
All right, we'll keep putting it back on for next time.
well,
We need some more discussion on it.
I'll just leave it there.
Yeah. Okay. For sure, you gotta put that on the agenda for our meeting.
okay.
So I can take it off of the regular, if you're gonna put it on the ARPA agenda. Yeah. Then ARPA agenda. No.
Make one.
Make one. Maybe I would just leave it on here for right now.
Just leave it.
One more week.
All right, next item, Region 9 Planning Area Agency draft plan. Is that? Does anybody have any information on that?
We had the information at last month's meeting. and we
Oh, that's
had-
right.
We just set it down. Yeah, we just sent it back for everybody to review because I think we just got it.
Yeah, okay, yep, I remember I read that. Let's stay.
Accepted that.
Yeah. So is it for motion to approve it or just to? I'll make a motion to approve the Region 9 Planning Area Agency draft plan and accept it as written. Motion by Bergie, supported by Thompson. Any other discussion?
It's in a packet from last month. But
Yeah, there was a signature required as well, you're right.
Yeah.
It's Carolyn, it does say that it should be noted that the approval and implementation of this plan requires no monetary support by the Board of Commissioners.
So does the chairman need to sign it?
I don't see any.
I didn't see a
for-
signature line on it.
Mm-mm.
No.
Okay, all those in favor,
Aye.
all those opposed, motion carried. On to new business. Bring us a claim, please, sir.
Okay, I'd like to make a motion to approve the pre-authorized claims and open claims presented for payment between June 15th, 2022 and July 7th, 2022 for check numbers 147831 to 148051, and each check numbers 1880 to 1890. The grand total of $521,884.85.
Motion by Dan, supported by Bill. Any discussion? Roll call, please.
Brumman.
Yes.
Small.
Yes.
Brady.
Yes.
Thompson.
Yes.
Gothier.
Yes.
Next is the Guston Township zoning ordinance for commercial wind energy systems. I want to speak to this because there are people in the township receiving phone calls about purchasing land for this use right now. So I would ask the board, and it's just a general, pretty much cookie cutter zoning ordinance for wind energy systems. And the biggest part in here to note is that money has to be put in escrow if they were fail to go down, that they can take all this junk out and vitalized land or whatever happens, that should put up a wind farm, and it has height requirements, so we don't have the really high towering ones, you know, it's the lower ones. Time sensitive, I think, and I would ask the board if we could approve this today. Yeah.
To waive the 30-day wait period for the Western Township zoning ordinance for commercial wind energy systems.
Move the second, yeah.
This does not include solar. does it?
They already have a solar,
They do have a.
they already have solar.
Okay.
Okay, move to second, any other discussion? Hearing none, all those in favor? All those opposed, motion carries, thank you very much. This is a real thing, people are calling right now to residents and saying, offering $2,500 an acre to put in wind stuff, so we're gonna move on this quick, they'll let me put.
And
all
all
the
the
other
other
one.
townships should start moving. in.
I really recommend that you talk to your townships, if you already have one, right, you already have one. Next up, Acorn Township Land Division Act Services Agreement.
So move and authorize chair to sign.
Support. Moved by Carolyn, supported by Bill. Any discussion? Just so, we'll do the land division. Yep, perfect. All those in favor? All those opposed? Motion carries. Next item.
I'm sorry, who was the second on that? Oh, thank you.
This next item, memorandum of understanding between Alcona Schools and County of Alcona, this actually has to be kicked back. Because there was some verbiage that had to be changed and, Mr. White was reviewing it right now. It's for IT services.
Okay.
So what it is, I'll say what it is. It's an agreement between Alcona Schools and us that if something happens to their IT guy and they need help, that John can step in or vice versa. We've had this agreement before, so it's not anything new. But there's some extra training that had to be included in documentation that Suter would need over there at the school to be able to work with us. So. But that will be in the next meeting. Next item is gas mileage rates. This is reimbursement to people who put in.
Yeah, I'll bring, I sit on the board of district health, and two Terry and I both were there at the meeting a week ago, and this was brought up, which I was unaware of, but effective July 1st, 2022, the Michigan Department of Technology Management and Budget announced that they are going to increase their mileage reimbursement to 62.5 cents per gallon. And I know the district health, we voted on it and passed that for district health, so I just thought that we bring it up for discussion here in Alcona County. We're at 50 cents. You know, I think the state has been at 58 cents the last year. So I'd like to make a motion that, so we can have some discussion on this, make a motion that we change our mileage reimbursement rates on Alcona County to 62 cents per gallon.
Second. Motion by Dan, second by Terry. Discussion away.
I would just, you did say 62 cents.
62 cents,
Yes,
not 5.
please tell us not put a half cent in there.
And I just think, in my discussion, my opinion, I know we've done everything we can ever since I've been here. Of trying to hold down costs, all that kind of stuff, but I just think that somehow we need to get in line, and mileage is one of them, and I think this is probably a time to do that.
How long we've been at 50 cents? Forever. Okay.
As long as I've been here, I think.
And I'm open for anything, I just do 62 cents.
Sure.
Because we should do it, but
It's easier to go follow the.
Well, that covers us for the next 5 years.
We can always vote it down if the prices of.
I don't know, well,
Well, the feds will lower their prices to that.
yeah. I think just follow the guidelines that are set forth, and, you know, I know district health had conversation of going to 70, and then when the state came out with this, then they just said, well, we're gonna follow state guidelines and did 62, so. I think it's just appropriate for all our employees and that use their vehicles to do county business. Everyone else that does that, 52 cents per mile. and everything is-
Okay, anybody else? Let's have a roll call.
Brady,
Yes.
Brumman,
Yes.
Small,
Yes.
Thompson,
Yes.
Gothier.
Yes.
And who will be doing the budget amendments for that?
Oh, Carolyn looked at that. We looked at it real lightly. It was about 1,700.
I did, I brought up only the general fund, brought up all the line items that are on travel. And, I was a little surprised, it came out between $67,000 current. And when you make the 12 cents per mile different, when I divided that by 50 and then multiplied it by 62.5. And it came out under $2,000 difference.
So there will have to be budget.
Well, we're
amendment.
gonna have to amend that, but.
But the general fund is not the main one that will be affected, and that it's quite significant in her mileage and other funds. But
It would be all funds. All mileage, I would assume.
Other than the finance.
there you go. Thank you.
It's not. Okay. Next item. No changes for start by that. It's coming up under, let's go right report.
Oh, I'm sorry.
Next item is the ambulance chassis. This is to purchase the.
Yeah, I think we've had this information for a couple meetings and that, and I'll make a motion that we approve the purchase of the 2010 Brown Chief XL ambulance on the Chevy Express chassis for $26,000. As Scott, this is correct?
Yes,
26,000?
26,000.
And to do with the paint and.
Well, I think that's a separate motion.
Okay. I'll second. Move the seconded to approve the purchase of the ambulance chassis as explained. Any other discussion? Let's do roll call.
Brady,
Yes.
Brumman,
Yes.
Gothier,
Yes.
Thompson,
Yes.
Small,
Yes.
Motion carries.
Then also in regards to that ambulance, it needs to have a little bit of work done on it. It needs to be painted with decal and that, I think Scott quote on that is 10,000.
10,390 and 64 cents. It does not include graphics, it's just the body work and the paint. The Alliar deer catcher guard on the front.
And some work on that thing too, right? On it, on it.
Body working paint.
Body
work
work
and
and paint,
paint.
yes.
Decals, you get those donated,
Graphics will come separate,
separate costs.
yes.
Any idea?
3,500. That's normal price for any vehicle that you're gonna get, whether it's remounted or brand new.
So you want to just prove the body work and that, so we can quote on that?
Yeah, saves us having to. Shuff around and.
I'll make a motion to approve the body work and painting and decal. For the new ambulance to be purchased in the amount of not to exceed 14,000.
Better go $15,000.
10, 6, and 35 is under 14. Does 14 work, Dave?
You got 10,4 plus, you said, it said 3,500.
I'll amend the motion to say 15,000.
There we go.
Support.
Just in case. Who to support it? Dan Carolyn. Any other discussion? Roll call.
Thompson,
Yes.
Small,
Yes.
Brady,
Yes.
Gothier,
Yes.
Brumman.
Yes.
This will bring our ambulance fleet average mileage hip shot to. Just hip shot.
gonna get it under 600,000.
Nice.
We're at 8+.
There we go.
And we're still in line for the next remount, and I've not gotten an update as to when Ford will or will not have a chassis. They said 2 to 6 months. 6 months will put us at the end of the year when we made the request with the board approval.
Thanks, Scott.
Thank you.
Next is the 2021 audit approval.
Yeah, I don't mind it.
Sent to us by Cheryl.
The auditors sent the client, sent that all to you. To be added for your signature, for your approval. You all had an opportunity to review the audit.
Yeah.
The F-65 report, the single audit was uploaded. We got confirmation of that today. I had to, log in to the federal website, to the clearinghouse to, verify that they were compliant. I forwarded that all to you today. I have to still, all the adjusting entries that were not given to us last year were given to us this year, and they were all input. Everything is, so everything that you see in the general ledger is final. We switched over the 30th of June to our new, we wouldn't be able to do any transactions after on July 1st because the cutoff is June 30th, so the whole system was carried over. There are some things that need to be looked at, budgets that were not adopted, they were approved later, so I just have to share a few cleanup items in that end that have to be cleaned up for 2022. I have not contacted Ken for a meeting. I don't know that I'll have him come down, but I will ask him to zoom in. That seems to work out well last year, so I will ask that he can zoom in at the next meeting. We were just trying to make sure we got everything done, all your papers were signed, and so he can come down and give a report on the impact of last year's audit in comparison to this year's audit, and hit any findings and issues that we have, we can report on. I don't think there's any more. I think all the items have been in. I know they worked real close with the clerk's office in my office in regards to getting everything ramped up.
There wasn't much to. No. On my end. Sorry, on my end.
Not on my end either.
So, a motion would be in order to receive this and ask our chairman to sign it.
Yeah, yeah.
I'll make that motion.
Second. Motion by Dan, second by Terry. Any discussion? Hearing none, roll call.
Brumman.
Yes.
Small.
Yes.
Coffee.
Yes.
Thompson.
Yes.
Brady.
Yes. All right, the last thing in new business is GIS contract change. What did I do with it? That was right. Here it is. John brought this in to me this morning. The only thing that's different, we signed it before and they changed the liability. Hold on a second. It's now Delaware Limited Liability Company, and it was someplace else before. So I didn't want to have this go outside with, it'd be different than what everybody agreed to. That's the only change.
Yeah. For that.
He just gave it to me. You probably don't have a copy.
So
John.
the company just changed names?
Just a limited liability, in the front of it, on the front line. It's still GIS Deacon Schneider. That's the only verbiage that changed in it. I had Tom Michael review. He said it was good to go. This is a precaution.
And that's, so I'll make motions to allow the chair to re-sign the professional service agreement between Algonquin County and Schneider Geophysical.
Second.
The change in the liability. Company. Moved and seconded by Brady and Small. Any other comments, questions? Hearing none. All those in favor? All those opposed? Motion carries. Motion, give me my copy here. All right, next item, finance report.
Well, first thing, so finance, we had a meeting last week, and it is our recommendation from the finance committee to Algonquin County Board of Directors to approve the following. Effective July 5th, 2022, the amount paid to our plumbing, heating, electrical, and building inspectors be increased from $50 per inspection to $60 per inspection. And that recommendation is both approved by myself and Adam.
Support.
Move and supported to increase the payment for inspectors for per inspection to $60. Any more comment, questions?
When was the last time we did it? We raised it to 50 3 years ago, maybe.
Maybe.
Something like that.
This is, yeah. Okay. Do you want to speak at all to the additional day? Or you can talk about?
Well, I don't know. Yeah, I mean, you know, we've had ongoing talks over there. I have with Terry Harvey and the inspectors on just, you know, what's going on, how busy they are, et cetera, et cetera. And one of the things we had is that when COVID hit, our electrical inspectors from Alpena. And he really kind of opted to kind of sit back. He went down to 1 day a week. And Kerry's really been working hard to try to get all his inspections lined up. 1 day a week, which is a Tuesday. There's been instances over the last 2 years that not being available the other days, especially after Tuesday, when it comes in Wednesday morning, and he's not available, yada, yada, yada. We had conversations with him and he has agreed to definitely go back to his 2 days a week, Tuesdays and Thursdays. Carrie's still gonna work with them, and if indeed she can hold the inspections on a Tuesday or Thursday, so we could do them all in 1 day to try saving travel time, fine, but if not, he has agreed to that also. Mechanical inspector's been already doing Tuesdays and Thursdays. They're all ready or available really anytime, and of course, Harry does 5 days a week, so.
Okay. Any further discussion? Roll call.
Brady,
Yes.
Gothard,
Yes.
Brumman,
Yes.
Thompson,
Yes.
Small.
Yes.
Motion carries.
Make sure it's got stuff back on the system.
Yeah, Cheryl, you got some stuff for us?
DPW, there was a bill that came in for inspections of the wells, not knowing what was going on, I made a phone call to Jesse at the road commission, in regards to the DPW and also the drain commissioner. And after a few discussions, I had left a message with him on the 24th, he got back with me today. That's why you don't have any paperwork in front of you, because they did not have time to put it together. We had originally budgeted $2,400 for the DPW landfill. There was an inspection that was done last year, and there is a specific schedule, and whoever is the liaison for the road commission, that's where the DPW and the drain commissioner meetings are held, and it may be advantageous to contact Jesse. We have this year, I believe, worked out very well, moving forward and preparing for the next few years. I'm asking that you increase $7,600 to the bottom line of that budget, which would mean an increase of $4,300. added to the original 2250. They have a fund balance of $3,300 that can cover the rest of the cost. And that would leave a basis for next year. Basically, it's putting $10,000 in there to cover the cost. And every other year, there are certain wells without any interruptions or any. It's not my forte, it's not my field of specialty, so I can't tell, all I can tell you is that in the next 5 years, they're gonna need approximately $10,000 average out through the years, because 1 year they're gonna have to have an inspection, the next year they're not. But if you can allocate $6,450 out of the general fund to the DPW, that should cover all the costs, with the exception of if there's something exceptional that happens with any of the dams. And that may or may not happen, but that's something that can be talked about later on. So bottom line, what I'm asking for is an increase overall in the DPW budget from $2,400 to $10,000 to cover costs for the rest of the year. And the reason I'm making it, so I'm trying to explain it the best I can, is because $4,300 will have to come out of the general fund as an appropriation to cover that portion of the need.
I'll make that motion. I'll support it. Move to second by Alan Bill. Question.
The wells, when you say wells, I know there's some wells at the old dump. Is there other wells throughout the
Yeah.
county? Really, what kind of, what are they?
That would be another discussion for.
For the
He-
drainage.
he's got it right now.
I know there's some at the dump, but I don't know where other wells.
There is,
I know the ones at the dump are periodically moved,
Yeah,
I mean, they
yeah.
test them every so often,
Yeah.
and one's offsite, I'm not sure, but.
Yeah.
So I'll get.
It's a
I
good question to
can't-
find out.
I
Yeah.
really can't answer that, and I think it would be advantageous for someone, actually the whole board, to be aware of what is
Right.
needed, and it's a lot more detailed, and I got a very good earful, but this morning in regards to it, it was very, I mean, I know a basic overview that we had wells that were being closed, and it was a 5-year plan to have them closed, and they're gonna be tested.
Yeah, but there's something about one of them, they
Yeah,
came up negative.
I had no
because
idea that happened, so there's been really no communication between the DPW and myself for probably 5 years, so in regards to the wells, I wasn't aware of anything that was any issues that were going on, but apparently there was.
Okay, we have a motion on the table. Any other discussion?
Where's the money gonna come from? Where's the money gonna come from?
She said general,
4,300 from general fund.
Contingency or somewhere?
You don't have that much left.
You gotta
You got
find
3,750 left.
it. You gotta find it.
Yes, sir.
well, we're gonna get motion approved, finance will find the money.
Yeah.
Okay. Those guys, a bunch of posers.
You gotta be coming up next week. So.
I don't like those guys, but you know. Okay, so the motion is to approve it, so.
Yep.
Any other discussion? Roll call.
Coffee,
Yes.
Brumman.
Yes.
Brady,
Yes,
Small,
Yes.
Thompson.
motion carries. What else you got for us?
Housing commission.
Okay.
That was all sent to you.
Yeah.
in advance.
This is basically increasing the budget for the grant with everything.
Correct.
So move.
Forwarded. Motion by Carolyn. Second by Brady to amend the housing commission budget to reflect the grant. Any other discussion? Roll call.
Thompson.
Yes.
Small,
Yes.
Coffee,
Yes.
Brady,
Yes.
Brumman. Yes.
Motion carries. What else you got, Cheryl?
Or just in general.
Well,
Here.
Now, if you're, we can go, we can say that for treasury report. That's it, finance then? Yep. Okay, personnel report, please. We'll take it this time. Turns out you're up sooner than I thought. Go ahead, Sheriff. Treasury report.
I really don't have a whole lot,
Okay.
just back to the audit. Like I said, there's a lot of things we're gonna be moving around, some funding from the Cedar Lake project, those three, and that's kind of, I'll be discussing with finance about that and present it to the board, because we're going to have to, we have to create a new fund for the debt service, and we've been working on that, facilitation, everybody's tax bills to them. And I'm sure everybody's got their new tax bills, and we've been getting phone calls, quite regularly, during the day. And that's really what we're working on. We really just have been trying to ramp up the audit and anything necessary for that. And taxes, did have, I think I mentioned last few weeks ago that we had one individual file and intent to file for the claims on the property. The deadline was July 1st. That was the only one we had out of the 10 properties that we foreclosed on. The website is up with the new properties that we have that we foreclosed on at tax-sales.info. All the information on the properties that we foreclosed on is up there. And if anyone's interested in bidding, feel free.
Okay, go ahead. From finance, just so everybody's aware, we received another billing, from our, the attorneys that are ongoing litigation, in the amount of about $14,800 something right in there. We had enough money in our legal line item, which leaves the spells about 13,000, but this bill that we received was only covering May. Once I received it, Stephanie gave it to me. I sent an email to Tom saying, hey, can we get out of this thing? This thing's going on and on and on. Of course, we can't. Tom was gonna call the attorneys and say, hey, what's going on with this? I mean, we're draining us on this and what's going on, but I haven't heard back from Tom. Okay, but we're gonna be out of money in that line item by the time we get the bill for June.
We have had a lot, I've had quite a few conversations and correspondence with them in regards to what's happening, where they are within that. One today is not a time.
Okay,
Can I jump next? We got our second tranche for the ARPA funding, the revenue. Character, whatever.
Yep.
The ARPA money. We got our second, we got our last
Installment.
installment. So you all know. Same as the first one. 1 million. And she gave it to me and I wrote it down and it's sitting on my desk.
no, you can't.
1 million plus.
Yeah.
1 million. No, 1,50,000. Oh, 50 years. Yeah, 1 million. It's weird. Okay. Thank you. On to the clerk report.
The biggest thing I have is the insurance renewal. After we accepted to proceed with the renewal process, that was all filled out by myself, 911, EMS, and the sheriff's department. And they proceed to take into effect basically any, all the collisions and claims or, so long story short, I only printed you, I have the whole renewal packet. But the biggest portion are the first page for you guys and what our costs were. So overall, with the increase, long story short, and the credits that we will receive, our bill will be less than it was last year because of the closing of the jail. Even with the closing of the jail, the increase across the board, he said, was the biggest spike in about 5 years. So there were considerable increases. And you had asked way back when. What the credit was that the county will receive from the state pool. They don't determine that. They don't let me know that until the renewal comes out in July. Cheryl was able to find in the GL that there was looks like we received the credits early August. And it cut my amounts
And it-
off.
And it's not in this,
It's less than that.
it's not in this.
If you, on the back page, that little graph,
Oh, okay.
it's the 4941 and the 1500. And then the to be determined is a much smaller portion than that $5,000 amount. Last year it was $437. This year, maybe 1,000. So about a $6,000 credit towards but it doesn't come towards the bill.
No.
Those are broken out into 4 installment payments, and then the credits received through
Oh,
the
okay,
treasurer's office.
okay.
So basically about $6,000 off our 107,000.
So we pay the 1.7, then they give us the 6.
Correct. Yeah. The only other major change in this, and in talking with IT and our representative, what happened are a lot of the cybersecurity things, the companies that they utilize through MMRMA, they would cover up to $5 million for a cybersecurity or a hack. These companies don't want anything to do with it anymore at all. And it's getting very hard to find companies that will even cover you. So at this time, MMRMA has decreased it from 5 million to 2 million. And they're working on other companies to see what they can do about that, but they are at least still offering something because some are completely dropping it altogether. And if you can pick it up, either through a separate entity, it is extremely expensive. So we still have a couple of questions going back and forth with the multi-factor authentication, which I know that you switched us over to mainly that.
Right, we're gonna up our antivirus, up a couple other things, our backups are now stored off-site. And they cannot be deleted for X amount of days, so we're doing as much as we possibly can to mitigate if we ever got hit.
And he's still looking further into it and he's gonna get back, but that was the first question I had to answer for him. Other than that, we had election trainings last Thursday at the Harrisville Township Hall. It was a very good turnout. The highest numbers I think I've ever seen. There were about 92 election inspectors that were trained. The classes were broken down. Some were kind of in the 30s. And we had a morning, an afternoon, and an evening. It was a very long day, but it went really well. And I think that's all I got. You made a motion back when to approve the renewal process with Burma.
Okay. so we're good.
MMRMA.
We're good.
You're good, yep. This is just your bill, letting you know what the costs are now, so.
Okay. So on to communications, they're in your package, browse at your leisure. Next is committee report.
Who are these communications? We want to talk about this, so,
Yeah, if you'd like to.
I mean. It seems pretty, I don't have a lot of knowledge about this, but reading these, I mean, it's. Something we should think about, a resolution on this, so
You'll have one for the next meeting.
we have one. Really? Who's writing it?
Yeah,
It's the Register of Deeds Office and the Association of County Treasurers have a strong stance they're working on the legislation and fighting that passing because it makes a huge impact to both of the offices and the revenues that come into the county as far as providing that information pro bono. We're just putting it out in cyberspace for whenever, when we have a legal obligation to charge for those, for certain information as well as the Register of Deeds office. So I can't speak to the Register of Deeds, but in representation for the treasurer's office, I would highly recommend you review those, and mine will be extremely similar to what you see there, because they have put out through the association of resolution in support of opposition of that.
Okay. Yeah. probably.
Correspondence sent out also earlier this year. on that issue. I sent out letters to both of our representatives.
Okay. Committee reports. Eric. District Health.
And then I just wanted to mention Dan, mention that we're there. I'd also like to say Dan has been instrumental in helping that with the project down here. Doing a lot of work for it and he's helped considerably for it. Personally, want to say thank you, because I know he's saving them a lot of money. And the veterans and also township meetings.
Dan.
Yeah, district health, there was no, NEMCOG or NEMSTA meeting in July this month. I had them last month. Nothing really major to report.
I don't have any big report besides finance, so how about you, Bill?
Well, we did a mediation meeting last Friday and or Thursday, and I don't believe it's hanging anywhere. It's just there. They had their union meeting with the mediator Friday. We're waiting for a response back on that. That's sort of tied up a lot of our different meetings out. I had a district library meeting and we're attempting to get a representative from MERS to zoom in to the next meeting to talk to the employees on what might happen or what their options might be after, or if they become a district versus library county. And that would give them a chance to ask their questions that we just didn't have answers for. That's about it. Going to township meetings.
Carolyn.
Hey, I've started working with the airport zoning board meeting. 211, invoices, and we have a personnel issue on that. As Bill said, EMS mediation has been a bit of a time. And Sunrise Center, we had a strategic planning meeting last week.
Oh, I do want to say one thing. Sue Eller will be here on July 18th between 2 p.m. and 3 p.m. Representative called me actually right before the meeting. I didn't see the room with you, so I figured get up, take a letter.
What is the time?
Between 2 and 3 p.m. July 18th.
Did you sign up?
I put it out on the thing here. Okay, the last public comment then, 5 minutes, please. Yes.
Aaron Pollock, equalization. Just a FYI to the board. I'm hoping that you guys seen the article about the illegal marijuana operation in Glenny at the school. That guy owns 5 parcels in Oconee County. Troy and I actually went to one of the parcels. And now that we know who he is and we, we're kind of going there unless he's not there. But he does own 4 pieces of commercial property, and part of our job when something sells is to go out. And then not only that, but being commercial, we make our rounds. We pull 10 to 20% every year. So this is kind of what I'm trying to get across, is we don't necessarily know what we're walking into. So just an example of when we were there and what we could have walked into. So, that's all. Oh, and the Zillow thing, I don't know. They contact us for information too, so if we could be kept in the loop of what we are and what we're not supposed to be doing, that would be great.
Thank you. Anybody else? Yes,
I
Mr.
just wanted to piggyback on some of the comments that Jerry Klingenberg made regarding the election integrity. I heard that at the most recent election workers training session,
that they were instructed that they absolutely were supposed to use Sharpie pens when voting. And if any of you have been following what's been going on since the last election, it was generally understood that that was part of the problem, that Sharpie pens were used when they were not supposed to be used. In fact, we're looking at a Michigan law that apparently is still on the book that says only a black or blue ink pen should be used. So I think it would be well within your rights to get an opinion from Mr. Weichel, whether he considers a Sharpie pen a blue or black ink pen. If you hadn't been following, part of the problem with the Sharpie pens was that they were bleeding through the ballots. The ballots weren't going through machines. They had to be separated out and then adjudicated or looked at separately, where there was multiple problems in that in numerous states. So I think that would certainly put a lot of people's minds at rest. If
Wasn't a
you were
problem
to-
here, that's for sure.
as to, it was well understood. I thought that it was supposed to be an ink pen rather than a Sharpie pen. So if you would agree, if you would ask Mr. Weichel, I think a lot of people would take his opinion more to heart than what Dominion or Election Source says. Following up on what somebody said about the election machines, I would be curious if you, as the board, would revisit the pros and cons of using machines versus paper ballots, both in cost standpoint and as far as confidence among your representative, the people you represent. I don't know if you know, a lot of people are considering not voting because they've lost trust in the voting system, lost trust in the machines. It's a horrible, horrible thing. So I'd like you to, if you could, just weigh the cost benefit. It might be very well, I know, Stephanie, it might be more easy to use the machines. If you knew that several people or many people of your clientele or your constituency were not going to vote because you were using the machines, I'd just like you to take a look at that and revisit whether losing people voting because they don't trust the machines is worth the money you're saving. Maybe you're actually not saving money. I'd be curious if are you obligated by a contract to use those machines? Are you obligated by the state to use the machine? Or is it well within your right to decide that you choose not to, as Oklahoma County, to use those machines? So, but in particular, if I would love to hear Mr. Weichel's opinion on what he understands that law on the book, saying a black or blue ink pen has to be used. We have the law, the statute. If he would check that, I would love to see his opinion on that. Thank you.
Thank you. Anyone else?
Oh, I was gonna say, Stephanie, aren't you supposed, you pick the
This is
machine?
not ask question time, and you don't get answers. This is just public comment. Sorry,
Okay, can I have a printout of that wind thing?
you can have my copy.
And then the well that was going in, what landfill are we talking about?
The old one.
On Walker Road?
Covered like.
Oh, that one. And you guys signed it or did this today. You put the motion and you went ahead with it.
Well, we said.
Oh, this is for, thank you.
Dawson Township. Do you have anything for public comment though?
Did you look into all this before you said yeah?
I'm the zoning administrator for Dawson Township, so yes.
You know what all wind farms?
Okay, but I'm gonna answer your questions after the meeting.
You
Okay.
don't though, Adam.
Stick around and I'll
You
talk to you
don't.
after the meeting.
I email you all the time and you
Stick
answer
around.
one.
Stick around and I'll talk to you after
This
the
is
meeting.
where we're at. We're starting to get pissed off.
Stick around and I'll talk to you after the meeting.
And there's proof. for
Otherwise, I
everything.
have to have you removed, okay? I don't want to have that happen. Patience.
If we want to know what contracts there are and how much money is being spent and why the money is being spent there and why certain people's things aren't being addressed, then that's redressing our grievances to me. But then when we ask a question or whatever, it's like a problem. Okay, I'll read through it.
Okay. I have a public comment here. I was asked to give some information and everything about the Veterans Affairs and what's going on. I know, Adam, you were at the special meeting, was back in April that we had with the building committee. I think it was you, Dave Hanson, Chili Smalls, myself, and Patrick. And we notified you guys that the BDA was giving us the property, that the buying it was no longer an issue, that it was being donated to us and everything, and, you made a comment about, you know, let you guys know about that. Now, I don't know what transpired between you and whoever, you know, that notified you and everything, but that's what was happening, was that the DDA was giving us the property, and, we're still on track with everything. We're still gonna be producing the paperwork for you after the minutes and everything come out and everything, to give you guys all that information with the list you gave us and everything. So we're not trying to pull the wool over anybody's eyes, you know. I was under the impression that from the information at that meeting was brought back to the board here and passed around, or maybe it hasn't, I don't know, but I'm letting you know now that, you know, that's what the issue was. We're getting the property donated to us. We've already been accepted for the grant for the 55,000. I'll be bringing you the contract for that, and you will have a choice for that. And, you know, everything's still moving forward. We're still gonna be bringing you that paperwork. So, you know, that was just one key thing. Now, you guys still have the say in if you're gonna accept it or not. That's on you. You know, the DDA just wanted to get this out there, and, you know, that's what they're doing. So
Okay,
hopefully, you know, nobody's mad.
Thanks. Anybody else have a comment? Anybody online? Oh, commissioners, additional comments? Good. Meeting adjourned until the next regular meeting. July 20th, 2022.